I'd like to introduce Kellie Kerin, a central Arrernte woman and rural and remote nurse here in Australia. You've had 26 years experience. I'd like to explore with you what is the difference about rural and remote nursing compared to urban metro nursing.
I don't think there is a comparison. It is such a specialised niche area of the healthcare profession, and the extra skills that are needed and the extra knowledge, there needs to be, like, the preparation is enormous. It's not something that you can simply just leave a metropolitan or a regional area and then all of a sudden go, oh, I want to do rural and remote. It's so unique. It's unlike any other occupation that available in Australia, to my knowledge, and I've moved around Australia a lot, have worked overseas, and still nothing compares to the rural and remote sector.
The framework is there to support rural and remote nursing. How would you suggest a rural remote nurse use the framework?
This level of support is there to be utilised, so I would be saying use it to your best advantage and put as much into it, because the more you put into this framework, the more you're going to get out of it.
Domain 1 focuses on cultural capability. Why is that important?
There's been so many gaps in trying to understand the general terms within our culture, and this is something that it's the primary focus around cultural safety. It's safety for everybody involved in that exchange, whether it's conversation, whether it's in a healthcare setting, whether it's under a tree. And we need to know that this is a safe conversation on so many levels, because there's so many misunderstandings, because this person isn't aware, and the local person is just simply repeating themselves because they've been telling their own story for such a long time. But for the listener, it's the first time they've heard their story, and that just widens the gap for safe communication.
And what advice would you give a young, early career nurse transitioning to rural and remote settings?
Do your homework. And one of the things that I think that I would be amazing to see is, with the ever increasing number of nursing agencies that continue to appear, there's the one thing that I still see missing. There's not that knock at the door, can I come in? Okay. We're not seeing that. It would be fantastic for the communities to have like a welcome mat.
So does the rural remote nursing generalist framework provide that welcome mat? Does it provide a framework for that nurse to actually understand where they need to build capability across the 4 domains?
Potentially, yes. And the reason I'm saying potentially is because there's still a lot of work to be done in supporting the resources, supporting the local people of their own communities, their own country, their own land. It's almost like putting their brochure together that can be developed and maintained, or updated and maintained, to have those resources in place so that welcome mat is constantly available on their terms. And then you have the agencies and incoming health, like the health services of incoming staff, who have got that information to say, this is what the welcome mat looks like. Mm-hmm. So when they arrive, it takes out all that potential for unsafe social situations and sometimes clinical practices.
So is reflection important within your practice?
Absolutely. That is, you just see my face, it's one of the things I'm just probably the most passionate about. And whether that's a combination of my personal experiences, my qualifications outside of nursing, reflective practice is the best set of skills that we can give to ourselves. Because if you don't go within, you're going to go without.
Let's thank Kellie Kerin, a central Arrernte woman, for sharing your insight and the support for rural remote nurses, and in particular how important reflection is and how the framework can support that. Thank you so much.
Great. Thank you very much, Shelley. Thank you for having me.